Last week's report was eagerly awaited by many in the global health community. First of all, it was a Herculean effort involving nearly 50 scientists, 300 institutions in 50 countries around the world. It assessed 235 causes of death, 67 risk factors, and was really a much more systematic, comprehensive effort than the last two iterations of the burden of disease report that were released in '96 and 2004. And this systematic, comprehensive effort to assess the burden of disease, risk factors, and injuries is important in global health really for two reasons. The first is that on an absolute basis, in trying to address a particular disease or risk factor without good data, good quality data on that disease or on that risk factor, really effective interventions are impossible. Without data, action cannot occur. The second reason why this effort was so important, though, is that it was a comprehensive assessment of disease and risk factors. So on a relative basis, it provides the ability to look at diseases and risk factors worldwide as they compare to one another, as they compare to previous iterations of the studies. And that helps policymakers both on the national level and on the international level think about where the priorities should be. And today we have a great panel to talk about these issues and unpack them. Unpack what the results of this report were in terms of the data specifically on household air pollution, but also to make that link between that data and what this means for our agenda for action, and third and finally, what the priority of that agenda for action should be relative to other global health risks and diseases. And I'm very pleased that we have such an esteemed group here to address those issues. I'm going to go through their bios quickly. You have them in front of you, so I won't go through all of their many accomplishments. But I'll start with Kirk Smith, who is the professor of global health environment at the University of California at Berkeley. His research addresses relationships between environmental quality, health, resource use, climate, development, and policy in developing countries. He's a real leader in this field, and we're lucky to have him here for this discussion. Next, we have Kalpana Balakrishnan, who is the professor of biophysics and serves as the director of the World Health Organization's Collaborating Center for Occupational and Environmental Health and the newly established Center for Advanced Research for Environmental Health at the Indian Council for Medical Research in Chennai, India. She has served in a number of international institutions in technical capacities, including WHO, UNDP, and the World Bank on these issues. She's a member of the World Health Organization Technical Working Group on setting guidelines for indoor air quality, relation to household fuel use, and again, is a tremendous expert on the subject, so it's great to have her here. Dean Lynn Goldman is the Dean of the School of Public Health and Health Services and a professor of environmental occupational health at George Washington University. She assumed this position after a distinguished career in government, including as the assistant administrator for toxic substances at the US EPA during the Clinton administration. It's great to have you here. Last, we have Sumi Mehta, who is the director of programs for the Global Alliance for Clean Cookstoves. Prior to joining the Alliance, she was the scientific lead for the Health Effects Institute on Public Health and Air Pollution in the Asia program, and is doing tremendous work in this area, and we're lucky to have her here as well.